This is Mark Lieberman, host of The World According to Mark. And my guest today on WPVM LP 103.7 on your dial is Dr. Elizabeth, who sometimes goes by Betsy, Dr. Elizabeth Tilson, who serves in North Carolina as the State Health Director and Chief Medical Officer for the Department of Health and Human Services. Thank you for being on the show today.
Thank you for having me. It's a pleasure to be here.
Well, I know that you have a lot to do. You're a busy person and we're in the middle of the pandemic. So we just have a short time to spend with you. So why don't we jump right in, and let me just give you the leading question. How are we doing in North Carolina relative to vaccinations and testing, the numbers of cases and so on and so forth?
Sure. Happy to cover that. And I hope people are familiar with our public dashboard. We have been very intentional about putting all of our data up on that public dashboard so people can follow along with us. And you can find that right at our website at DHHS, our website. You can see where we're tracking in our 4 key metrics that we've been tracking throughout the pandemic, looking at the people who are hitting emergency department with COVID-like illness. That's really an early indicator of people who are sick. We also look at our number of diagnosed COVID cases. We know that's an undercount, but the people who are getting tested. We look at our percent positive of all those tests, how many are actually positive. And then we also look at our hospitalizations. And then those 4 key metrics, the good news is they are all trending down, which is really, really good. Now, we still have a high level of viral transmission across the state, so we're not over the pandemic yet, but we are definitely going in the right direction. So that is all really good news. And then on the other side, also on our dashboard, you can see where we are with vaccines. And we are doing really well with vaccines, very high rate of getting our first doses. What's delivered into the state, into people, really high speed. About 100% of those doses are administered to a person within a week of being in the state. So really high levels of vaccination as well. So that is all good. We are not there yet. We aren't through the pandemic yet, but all of our trends are going in the right direction.
So unlike some other states, which can only describe their situation as being at a plateau, North Carolina is still trending downward in the key metrics.
That is correct. And actually today will be one of the first days that we've dropped below 1,000 cases since October. So we are still trending down, and our percent positive is still trending down, which is really good.
Do you have a sense, Dr. Tilson, as to where our hospitals are as being able to handle the capacity of COVID-19? Or do we have an overcrowded problem or a lack of the available equipment and things that are needed to treat those people who have been admitted?
Yep, and all that data also is up on our public dashboard as well, looking at hospital capacity. We are okay right now. And in fact, then today was the lowest day of new admissions in our hospitals. So we are okay with hospital capacity, ICU capacity, bed capacity. We are okay.
Okay. So let me ask you a question which has gotten a lot of publicity or press essentially over the last few days. There are a few states, well, there's a number of states who never did have a mask mandate. And now we've gotten information of a lot of states that are dropping the mask mandate that they had, other states that are considering dropping it, and states that are talking about increasing the number of people who can be involved in indoor venues. Where do you have a sense of where North Carolina is regarding masks and social distancing issues and relaxation of those?
Yeah, so we've been very mindful of our easing restrictions, and we are used what we call a dimmer switch approach. We're gradually either tightening down or gradually loosening, and that's what you saw in that last executive order, was kind of a gradually loosening of restrictions. The concern is if we were to go wide open without any restrictions, we're still not out of that pandemic, and we could have a big rebound, and especially because there still is the risk of the variants getting more of a hold in North Carolina and potentially having another surge. So we're being really cautious and metered in our approaches and easing restrictions in that dimmer switch. And the same thing with mask mandates. Really, masks are one of the most effective public health prevention measures we can use, especially until we have many more of our people vaccinated. So masks in public spaces when you're socializing with people outside of your household are still really important preventive measures. So we're not there yet to be able to loosen all of our restrictions and get rid of that mask mandate.
So again, some of the articles that I've read recently are saying that the percentage or the degree of efficacy of the vaccines that has been discussed, we now have 3 vaccines that have received emergency use authorization in the United States, but that those good figures about good efficacy actually depend upon social distancing and masking measures staying in place. And yet, again, some of the states have taken a different view. Are you concerned because North Carolina, doesn't live in a vacuum, and they say the virus doesn't respect borders? Are you concerned about neighboring states which are taking a less conservative, less mindful approach than you've expressed about the dimmer switch?
I think you're right. The virus doesn't show any borders or boundaries. We know that people move across the state a lot and also move across borders a lot, and the virus will move with them. So I think for at least North Carolina, the state that I'm responsible for making policy, we really want to be sure that we are continuing those preventive measures as much as possible. That's what we.
But there's no expectation, for example, that North Carolina, in order to stem the tide of people coming in from other states without masks, we're not going to take specific measures to deal with that, or maybe there are no measures that would be effective in preventing that.
Well, I think that we have a lot of people that come into the state for work. A lot of people enter the state for a lot of different reasons. And when they're in North Carolina, then we are expecting people then to follow North Carolina rules while they're in North Carolina. So that's what we can do.
Okay, so let me talk a little bit about the rollout. I think it's fair to say that the rollout of vaccines in general were very rocky in the beginning, and there's a lot of reasons which I may go into later in the show. But we didn't have a good federal leadership, and we didn't know essentially how to set it up. I know for one, in my own experience and from what I've talked to other people, they had a lot of difficulty contacting the right places, not being put on hold, being on a list, then not being on the list. Where do you think we are as a state now in terms of making it easier for those people who have not yet been vaccinated to get vaccinated?
And I think you're right. In the beginning, things moved very quickly. And also in North Carolina, we're a very decentralized state, right? So we have 100 counties doing things 100 different ways. And so in the beginning, it was pretty rocky. But on our website, we have 2 really important tools that we hope people will use. And on our website, which is Find Your Spot, Take Your Shot, we not only have a screener that you can figure out what eligibility group you're in, but also you can search for a provider that has vaccine, and you can search based on what is the proximity to where you are, and it lists all the providers that have vaccine and those contact information as well. And so we're making it a lot easier for people to navigate to providers that have vaccine through that site on our website.
Go ahead.
I'm sorry. As we're having more and more providers come online, right? So in the beginning, it was just our health departments and health systems that have vaccine. Now we've really increased the number of providers that have vaccine. We have a lot of our federally qualified health centers, our rural health centers, other primary care providers, and a lot of pharmacies as well. Walgreens has come on as part of our federal retail pharmacy program. CVS is coming on board. We have a lot of independent pharmacies as well. So there's a lot more points of access, as well as these better tools to help people navigate that access. And we also have a call center for people who aren't able or facile to go through a website. We have a call center as well that people call to help get navigating. We're also partnering with the AARP to help older people help to navigate as well, who may be a little less tech savvy.
Okay, so early on, the problems where people actually put themselves on a wait list or had an appointment and only to find that the appointment had been canceled because of the lack of sufficient vaccines. Do you think that problem has mostly resolved itself with the addition of all these new access points?
That is what we're hearing. In fact, we're hearing that people's wait lists have really dried up, that people put themselves on multiple wait lists and then went to one provider and didn't take themselves off of a wait list. So we are hearing a lot from our providers that, yeah, their wait lists are drying up, that they're able to really meet demand. And we're having more vaccine come into the state, more vaccine, not just through our state allocation, what North Carolina has given, but also we're getting additional federal doses. So again, we're having federal doses going to CVS and Walgreens. We're having federal doses go to our federally qualified health centers. And then just this week, we have a new FEMA site that's going up in Greensboro, where we're getting additional federal doses directly to that FEMA site. So we're having more doses come into the state, more points of access. And we are finding that those wait lists are drying up and people have more ready access to vaccine in a more timely fashion.
Okay, I know we have just a few minutes. There's a couple other questions I just want to give you. Hopefully you'll have time to answer them. One is in terms of choice of vaccines. There are three possibilities. I don't know whether North Carolina has been allocated the Johnson & Johnson one shot, but are people going to be able to, or should they consider making a choice as between Pfizer, Moderna, Johnson & Johnson, and any other vaccine?
So we do have all three vaccines in North Carolina, which is great. And I will say all three are incredibly good at preventing death, preventing severe illness, preventing hospitalizations. They're all very, very good at preventing those really bad outcomes of COVID, which is exactly what we needed them to do. So they're all very, very good. And so different providers may have, mostly providers will have one vaccine or the other. So if somebody is making an appointment, they can always ask the provider, what vaccine do you have or not? But they're all very good in preventing those severe outcomes with COVID, which is what we really needed them to do.
So as a follow-up on that, there's been a lot of concern expressed about mutations and the extent to which the vaccines that are available are going to be effective, and do they need to be modified, and do there need to be boosters? Do you have a sense of that at this point, and are you prepared for that?
Yeah, we talk about this a lot. So there's a couple things when we think about the variants. One, we do know that there are those variants in North Carolina now. We know that. What we need to do, especially this month, this is a critical month for all of us, is to be sure those variants don't get a good stronghold and don't spread really quickly, which is why keeping up those preventive measures in March, incredibly important, so those variants don't take a hold like they did in England and other parts of the country. So keep that mask on, keep those social distance in March, critical. Second, that and people get vaccinated as quickly as they can. So as soon as they have access to vaccine, get a vaccine, because the more, again, we can prevent that spread by the preventer the vaccine, the better off we will be, and the less problem we'll have to deal with down the road if those variants take hold. What we're learning is the vaccines are pretty good with the UK variant. But we're still learning about the other variants, the one from South Africa and Brazil, we're still learning about that. But for the one from the UK, the vaccines to be very good with that variant. But the most important thing we need to do right now is prevent that spread of the variant in North Carolina this month. This is a critical month. So keeping up the preventive measures and getting your vaccine as quickly as possible will be how we can prevent that spread.
All right, so I know we're just about running out of time. Any particular new strategy on dealing with refusers and objectors to vaccines in order to make sure that this vaccination effort is successful?
Yeah, and I never want to be in a place where we're coercing people or making people feel uncomfortable. Our job is to be sure that we have reliable, accurate information. We have that all on our website, making sure we're working with trusted messengers that are talking with people, that everybody has accurate information. I think that's the best way that we can really help people increase that uptake of vaccine is make sure that they have that reliable information through a trusted messenger. So that's been our strategy all along. I never want to coerce or force, but we need to be sure people have that knowledge to make that informed decisions, and they're getting that knowledge from trusted sources. And so that's been our strategy.
Well, I want to thank my guest, Dr. Elizabeth Tilson, for being on the show. You have an upbeat point of view, a good and clear message, transparent. Everybody should go to the website, and I guess they'll figure out how to get to it, or you can say it one more time as we close.
Yeah. So either you can just search North Carolina Department of Health and Human Services. It will bring you directly to the COVID, or Your Shot, Your Spot, yourspot.com also can get you directly to it, but it's hard to miss. Just Google NCDHHS, you're good.
Well, thank you very much again for being on the show today.
Okay, thank you so much. Really appreciate it.
In our last segment, we had Dr. Tilson, who is the State Health Director and Chief Medical Officer for North Carolina. And we were talking about where North Carolina is in terms of its precautions and distribution of vaccines and setting policy to move the state forward in the program for trying to get rid of the pandemic in North Carolina. Now I want to bring on another guest who I know very well. She's the producer for the show through her company, Focus Solutions. I have Shelley Lieberman on the show. Shelley, thanks for sitting in.
Welcome. I'm happy to be here and help you.
So we've both been vaccinated. We got our second vaccination, and we have a lot of issues that we've been discussing with our friends and colleagues about the vaccines. And I know that you have some questions you want to ask me, and I'll do my best to answer them. So why don't you start off with your favorite question?
Okay, my favorite question is, what do you think is fueling the anti-vaccine movement? I've been reading, and I know that in the past there have been some real reasons for being anti-vaccine oriented. One being that I think a long time ago there might have actually been mercury in the vaccines, but I know that was definitely eliminated. Also, the Tuskegee experiment, in which Blacks were deliberately withheld their treatment that could possibly cure them. So there is some basis for this, but now there certainly is an anti-vax movement. And I'd like to ask you, what do you think is fueling it? And what do you think can be done to overcome this hesitancy?
Okay, well, let me comment first. I don't know about the mercury issue that you mentioned. I want to make it clear for our listeners, there's no indication that the current vaccines that have been authorized through the emergency use authorization by the FDA has had a mercury content issue whatsoever. So I think that the issue you're talking about in terms of history in this country, in terms of vaccines and disparate medical care and discrimination against minorities, not just Blacks, but experimentation on prison populations, you're right, that probably contributes to some, shall we say, vaccine hesitancy. I think what's important from my standpoint is there's a difference, I think, between what has been referred to as vaccine hesitancy and the so-called anti-vaccination or anti-vax movement. Some of the concerns that we're hearing and that people are expressing about not getting vaccinated is simply people don't know enough about the vaccines. They know that the vaccines were developed in a relatively, or actually an extraordinarily short period of time compared to vaccines for measles and vaccines for polio and so on and so forth. And so naturally, there is a certain reticency or reticence in terms of taking something. Secondly, obviously, there are some side effects associated with the vaccines. You and I have both experienced that, and we know lots of people who have. I don't believe that there is any substantiation for serious problems with the vaccine, except for people who potentially have some known allergy and along those lines. But basically, if there had been a significant amount of problems with the vaccine in terms of people getting very sick, that would have come out, I believe. But let's talk about, again, sort of a more baseline issue. There's been a strong anti-vaccine movement in this country for a long time, well before COVID. And I think that there are things that are different now about COVID-19 vaccine, in that high officials have expressed some not only hesitancy, but basically saying the vaccines aren't necessary. That was clearly the case in the previous administration, the Trump administration. But even today, we're still hearing people in Congress and people who presumably should know better expressing the belief that the vaccines are either not necessary or more conspiratorial themes that I think we've both heard, people claiming that there are chips or some tracking device that's included in the vaccine. There's absolutely no foundation for that whatsoever. So I think that nonetheless, we're in a period of time where people are allowing themselves to be heavily influenced by, again, outright lies that are being spread by various groups. I don't want to say that they're all groups on the right. I think it's groups on the left and the right. And that sort of expression of concern and lack of trust in the institutions is got to make some people, or has made some people, hesitant about moving forward with taking their vaccines or with getting the vaccines administered. And the concern, I think, that everybody in public health, physicians and hospitals and doctors alike have, is that if there is a holdback or holdout of a substantial portion of the population in the United States, that we won't get to what's been called herd immunity, that we'll have so many people, or too many people, who have not been vaccinated and therefore don't have any degree of immunity, and the pandemic will continue on, or at least the incidence of COVID-19 in the general population will go on. And more disturbingly, and we touched on this in the previous segment, that the mutations of the virus will continue to spread, or there'll be new mutations, and we won't be able to get this COVID-19 under control. That's my sort of sense of things.
So it seems like they say about two different groups that the hesitancy reflects. One group are true anti-vaxxers that don't believe in any vaccination. And then there's another group that just seems to be hesitant because of lack of information. You even had a conversation with somebody and they said, wow, I didn't realize that. And I believe that with more information, more people will be willing to take this vaccine. What would you suggest, Mark, in a marketing campaign to get people to take the vaccination? What would you think?
Well, I don't hesitate to call it a marketing campaign, but what efforts, I mean, the efforts to get people accustomed or comfortable with taking the vaccine, as you say, those that are merely hesitant are probably going to be more easily influenced by more education that explains why it's important to get the vaccine, why the side effects, or the fact that the side effects are very slight. You know, you'll have arm pain, or you might have chills or flu-like symptoms for 24, 48 hours after the injection. I think, you know, those are the sorts of things that you would expect would influence people who, again, are just concerned, but not subject to some conspiratorial theory. Those people that believe that, you know, Bill Gates or George Soros, or name your favorite boogeyman, that this is just a plot, or that the folks, quote, so pushing the vaccine are simply in this to either make money, kill people, track people. I think that's a much harder nut to crack, and I don't think it's just a question of education. Perhaps if the rates of infection continue to go down, and the numbers of people who get very sick and have to be admitted to the hospital go down, as Dr. Tilson was pointing out was happening in North Carolina. Even some of those folks who've been more wedded to the notion that all vaccines are problematic might be persuaded. I think it bears mentioning, and this is something we could go into without getting into the weeds. There was, you know, this was somewhat of a, not somewhat of it, this was an unprecedented push getting, right now there are 3 vaccines that are available in the United States, and we can assume that there will be more because there's, you know, literally hundreds of companies that are still working on vaccines. The vaccines themselves, it's fair to say, are not approved in the sense that drugs are approved. In other words, the process for getting a drug approved does almost always require years before it goes through the entire clinical trial and gets complete approval. The technique that was used by the FDA, it's not unprecedented, emergency use authorization, is basically saying, in light of the circumstances of a worldwide epidemic, otherwise called a pandemic, and the fact that there's a significant possibility or probability that lots of people will be affected and either have serious illnesses or die, and there are no really significantly effective treatments, the FDA said, we're not going to short circuit reviewing the data, but we're going to do this in a quicker fashion. But it's important to note that the studies of these vaccines and the studies of the various mutations and the studies of immunity, those things go on. In other words, it's not a full stop in terms of the approval process. That technically that these are not, quote, fully approved vaccines, but they were subjected to the rigors. And it wasn't as if, you know, one day in January or February that they just pulled these vaccines out of the hat. They had been working with variants and predecessors of COVID-19. The 19 is an indication that it's the 19th virus in this general family. So they had something to work with. Plus, there was a massive worldwide collaboration. It wasn't just in the United States, but countries across the world were pooling resources and using genomic testing to evaluate what seemed to work and what didn't work. And that's why these vaccines came out so readily. Also, obviously, it should be noted that despite all of the problems that we had with the previous administration in terms of paying attention to this and so on and so forth, there was a lot of money that was provided to vaccine producers to basically lessen the risk that they would be trying to develop something and there would be no market for it. A lot of money was put in place. So that's why we have the vaccines. the question you're raising and is how do we turn people around? I think it's going to be a long process. It's going to take time, and some people will never turn around. Hopefully, the percentage of people that decide not to get the vaccine is small. Some of those people are obviously going to get COVID. If they get COVID, then there's a degree of immunity associated with that. And maybe we get to that, magic number, whatever it is, 80%, 75%, 90%, where the vaccine dies down. And, but that's not to say that we'll see the end of it in 2021 or 2022. The likelihood is that people will have to be revaccinated, and people will hopefully take some of the other precautions, such as hand washing, masking, social distancing, seriously, and continue to observe that so that we have protection and we can return to some degree of normalcy soon.
Well, I think one of the major deterrents has been how difficult it's been to get an appointment. And that is, a lot of people have just said, forget it, I'm just not going to bother with this. But I do believe that that is being overcome now because there's so much more supply. And in the first segment of your interview, how many vaccines are going to become available, and that the wait lists have been drying up, as the doctor was talking about. So I do believe that more people, when they find out how easy it is to get the vaccine soon, I think that's going to help the situation, alleviate the situation.
Well, I think you're right. I think Dr. Tilson indicated that not only is there a larger supply, partly because we have Johnson & Johnson coming into the picture, and the other two vaccines which have received emergency use authorization, Pfizer and Moderna, are continuing to produce and producing in bigger numbers. I think, as you indicate, and as I talked to Dr. Tilson, the problem was partly that there wasn't enough vaccine available, but most of the problems, I think, were that there was no planning. There was no planning at the federal level, and trying to do mass vaccinations under the best of circumstances presumably would be hard, but trying to do it in a bifurcated way where each state has to sort of work out its own solutions is much more difficult. And until this latest stimulus package, the states really didn't have enough money to do an effective rollout. There weren't enough people who could give vaccines. There weren't enough people who could man telephones. The experience that a lot of people had were just horrible, having to call 4 or 5 different numbers, having appointments made, and then having the appointments canceled because the vaccine didn't show up, and being just all of that was problematic. There's no question but what again, despite what Dr. Tilson said, that has gone away. I think that a rollout which depends upon public health system, and also depends upon a buy-in by big companies like Walgreens and CVS, there are still going to be issues about how do you find who has it, who's close by, who has the vaccines available. And I think that problem is, as you say, is starting to solve itself. And the more time that passes and the more experience the vaccine centers have, and you also have some of these mass vaccines that are taking place in baseball stadiums or football stadiums or whatever. That obviously is important. I think the one thing that you haven't mentioned is there continues to be a concern that certain groups of people aren't getting the vaccine. So why don't you speak to that?
Well, my question to you here is, there is a disparity between people of color, that community, and the whites. population. Even in Florida, there was a disgusting situation where the governor moved the vaccines to a all-white, affluent community and allowed them to get this vaccine first. So there is a disparity as of now. I'd like you to address there is. So what do you think can be done about that? And do you think it's just will be alleviated by more supply? I guess some of my ideas would be perhaps mobile units that go out to the communities, the poorer communities. What do you think?
Well, let me just first say there are alleged disparities in terms of who's getting it that seem to be based on race or ethnicity. There's also alleged disparities between urban dwellers and rural dwellers. The incident that you mentioned, it was publicized about Florida and perhaps the Florida governor. You know, who knows? I don't have all the facts in that on that. It wouldn't surprise me. It also doesn't surprise me that some people were able to get the vaccine because of connections and because of who they knew and leverage. I think, and the President Biden has spoken out, and folks that are involved with health generally and COVID in particular have said there's absolutely no tolerance at the federal level for disparities in terms of certain populations not having ready access or not having sufficient quantities of the vaccine. And I'm sure he means that. But in the system that we have in the United States, um, actually making sure that populations of color, rural populations, other folks, there's a whole issue now about immigrants. Question of whether immigrants should be able to get, or undocumented immigrants is the discussion. Should they be able to get their vaccine before, quote, a bona fide U.S. citizen? I think a lot of that is just unfortunate and frankly ridiculous. Anybody who is in a position in this country who can either get the disease or transmit it or both, we need to find those people and we need to vaccinate them. I think another complicating factor was that they, for good reason, had this class or priority system. First, it was anybody in a nursing home, as well as anybody that was over age 75. That was where the federal thinking was. And then it moved to 65 and older. That was a preferred class. And now, particularly, or even in this state, there's a question of who else needs to get it. Frontline workers, medical folks, those are, considered quote essential, which is a sort of an unfortunate term. But people that are in close contact in restaurants and grocery stores and so on and so forth, even if they don't meet the age requirements, there's a good reason for those people to have it. And what I think we heard and read was that because of those levels or classes of people who were considered eligible, there were vaccines that went unused. There were vaccines, we were told, that had to be dumped because, particularly in the case of Pfizer and also Moderna, they had to be, in effect, refrigerated or kept on ice. So I think that also helped to create some of the problem. But now I think that the lens has been focused on disparities that presumably or seem to have some racial proportion to it or some racial issue. I think those are going to be addressed, and they should be addressed, because there's absolutely no justification whatsoever. That doesn't mean that it's going to be solved next week or even next month, but with there now seeming to be adequate supply, there still needs to be logistical determinations as to how far down the list do we get. Are we as far as school age children? Is it kids that are 8, 8 and above? Is it teenagers? What about preschoolers and so on and so forth? And I think that while there still are, some concerns about logistics as well as supply, it does seem to make some degree of sense that the people who are most vulnerable to not only getting COVID, but also most vulnerable to getting really sick from COVID because of age or comorbidities, or because of what they do for a living and the close contact they have with other people. Those again are things that I think over time, but hopefully quickly over time, will be resolved.
I think they're doing testing with children now. It hasn't been approved yet, but maybe in the future it will be approved then for children. I believe 18. I think they're getting ready to think about high schoolers getting it by fall.
Well, it varies again, that every state has got a different concept of what that needs to be.
There is the next question that I wanted to ask is, why are governors like those in Texas and Mississippi and soon Alabama, why do you think they're lifting the mask mandate now? Do you think it's too soon? What do you think can be done to compensate for this?
Well, first of all, let's set the stage. There were a number of states from the beginning of the pandemic where the governor and the state health authorities were unwilling to even declare a mask mandate. I think there was as many as 14 or 15, even at the height of the pandemic, who basically said it's a choice. People should be able to make their own choices. What is even more disturbing is that in many of those states, the states didn't even allow individual businesses to make specific decisions. They said you cannot force people to make a decision to wear a mask. That I think that's unfortunate, and I think more consequentially, I think it led to a lot more cases, a lot more hospitalizations, and a lot more deaths. It was a very short-sighted way of dealing with the pandemic. So I don't have a lot to say about why. There were exceptions made for masks in terms of very young children and people who could say, in effect, that they couldn't wear it because of some medical condition. But I think all that was really sort of disingenuous. Most people can wear a mask. And if you can't wear a mask, then don't be in proximity to anybody where a mask would otherwise be necessary. The arguments that I've seen, there's no scientific evidence to support not having people wear masks when there is the wide transmission of a disease that could be caused by COVID-19. Just none whatsoever. Why states like Texas and Mississippi and Alabama, you mentioned, there's probably other states, not just in the South, but the South seems to be particularly sensitive to what people are saying is their rights, freedom. They should be able to individuals should be able to make the decision about whether they do or don't wear a mask. The problem, I think, that's obvious from that standpoint is it's not just about them. The mask has more effect on preventing transmission from them to somebody else, less so, but still apparently effective, particularly if you do double masking of that person picking up the disease from someone else. So it's a social compact we have. And I basically analogize this to, wearing seatbelts, and maybe even more so. Nobody wanted to wear seatbelts in the beginning. People had the choice to wear seatbelts. Seatbelts were put into cars. And for a lengthy period of time, people didn't buckle up. So then you had education, you had advertisements, and then you had laws put in place that said, if you are not wearing a seatbelt, you're breaking the law. And that seems to me to be pretty well documented as a success in reducing the number of very serious bodily injury as well as fatalities in driving an automobile. And I feel like this is the same. Why? What could possibly be the motivation behind what Texas and Mississippi and others are doing? I mean, I hate to say it. I think it's pure politics. It's one thing to say we want schools to open up, or we don't want businesses to fail, so we need to allow them to open up. We allow them to increase occupancy. I mean, those are decisions that there can be an honest discussion about. But to simply say we don't need the masks, and particularly again, Texas and Mississippi and certain other states, they're eliminating the mask mandate at the very time in which their numbers are still up there. Maybe they've plateaued, maybe they're still trending upward, maybe they're trending downward, but the number of cases is still high, just based upon the sheer numbers. Some of them, rivaling the higher numbers that were apparent earlier or late last year, the summer of last year till the end of the year. So it just seems totally unfortunate that just at a point in which things are starting to look better, but we still have a significant minority of people who actually have gotten both doses, or the doses they need for the vaccines, that the governors are playing politics, because there's a substantial number of people, we've seen them on camera, who say, it's my choice. I don't want to wear a mask. Nobody should force me to wear a mask. I mean, none of that is either acceptable or makes any sense, again, if the long-term goal or the midterm goal is trying to eradicate this. So I can't come up with any good rationale. I haven't heard any good rationale that supports what Texas and Mississippi and what Alabama might be doing. And I think Dr. Tilson basically had her finger on the correct point. She looks at this as a dimmer switch, that as things improve, there can be a relaxation. But it seems to me getting rid of masks might be like the last thing you want to do, because it doesn't have a negative impact on people going back to work. It doesn't have, I mean, yes, it's inconvenient. Yes, it's harder to hear people. Yes, people don't like, having to breathe through a mask, but it doesn't actually prevent people from going back to work. So I don't see what the negative consequences are to the economy. And frankly, if it's a choice between the economy and people's health, I think we should be going with health every time.
So it looks like local communities, mayors, and a restaurant association are basically saying and encouraging the continued masking and not full capacity. And I think it's up to the local communities then to basically compensate for this. It's up to them. And I think that could possibly ameliorate the negative effects of the total unmasking. Do you agree?
In part, I do agree. Obviously, well, first of all, again, this is very much of a state by state issue. We know that in Texas, some mayors have spoken out and to say, the mayor of San Antonio, the mayor of Austin, I think the mayor of Houston, and I think I heard a mayor from Jackson, Mississippi, say we're going to still keep it in place. Here's what I consider to be the problem. Again, mixed messages about something like this, which is empirical. Masks do prevent the transmission of disease, period, the end. If that wasn't the case, then why would you go into a hospital and allow a physician to basically get around you and expose you and not wear a mask? Why would you, people have been accepting mask wearing for your dentist, your dental hygienist, ever since the AIDS epidemic. People have been wearing masks. Masks serve a purpose. They work if they're properly used. So can the fact that some businesses may elect to require masks, or that some mayors may elect to go against or chart their own course different from what the state is saying? First of all, some of the governors are saying they won't allow a city to make a different determination than was made on the state level. That when the governor lifts the mask mandate, he or she means it. Nobody should be able to react differently in a different municipality. Secondly, there's the obvious point, is that people are mobile. If one city chooses to do something differently than others, you'd have to monitor somebody coming in from out of state where they don't have a mask mandate. It's a mixed message sort of thing. And I think, again, as I'd addressed with Dr. Tilson in the previous segment, if South Carolina, for example, or Tennessee, or the contiguous states where there's a lot of traffic, particularly if when traveling starts picking up, it's going to be very hard to administer. And more perhaps importantly, I possibly should have said this first, is put yourself in the shoes of a business owner. If a particular business owner wants everybody to wear a mask, that business owner is going to be faced with people who will say, well, the governor said it was okay, so I'm not wearing a mask. So the business person is put into a difficult position. And not just the business owner, but all the people that staff that particular business. Do they insist? Do they have the sign that says no entry if you're not wearing a mask? If there's not penalties, if the state mandate goes away, and it's up to individual businesses or individuals to make their own decisions, there's no teeth in the enforcement mechanism. And therefore, I think there's going to be a rising number of people and a rising number of businesses that are going to have a rising number of maskless people coming in. And if there's increased occupancy, as that seems to go hand in hand with the relaxation or the elimination of the mask mandate, I think we're going to continue to be in trouble. And we're going to continue to be in trouble in terms of mutations in people who never had COVID and never been vaccinated. All those things, I think, spell potential disaster. Maybe we'll be lucky. Maybe there'll be enough adherence to this, but taking away the mask mandate on the state level doesn't really seem to make any sense.
Yeah, and I heard one disturbing radio announcement about one restaurant firing employees that continued to wear masks. And the restaurant, of course, refused, saying, no, my employees will wear masks. It might be up to the individual patrons whether they wear masks or not. But I find that very disturbing.
Yeah, well, that's, again, the just sort of thing that happens when there is not clear messaging. And let's not forget, this goes back again to, it's ad nauseum to keep repeating all the issues of concern from the previous administration. But Trump mocked people that were wearing masks. Trump held rallies with people not wearing masks. People on the floor of the Senate and the House have not wanted to wear masks. So, and people will say, well, even Dr. Fauci or the CDC changed course on whether masks were effective or not effective, and so on and so forth. There's a certain element of that is perhaps true. But the way I think it factors out is that early on, when we were still learning what we needed to learn about this disease, there was some questions raised about the efficacy of the masks and whether or not wearing the mask potentially would make the user of the mask more susceptible. But that has long long gone away and been dispelled as, you know, nothing more than QAnon conspiracies or other conspiracies. So we've had now an experience of several months where masking has increased in most states and in most municipalities and most areas. And that has gone along with the reduction or the plateauing or the trending downward of serious cases of COVID and overcapacity in hospitals. A lot of that, of course, is attributable to the vaccines. But again, the vaccines have still, or the majority of people have not gotten even their first dose. A larger number have not gotten their second dose. And some portion of the people that have gotten vaccinated haven't had the 10 to 14 days period where the maximum efficacy has kicked in. So it defies reason that social distancing and mask wearing was not a part of the constraints now that we see on the spread of the disease. But I just think it's a complete abdication of responsibility and pandering to people who never wanted to wear masks to begin with, to lift the masks now.
Yeah, and we just heard from the CDC that people who have had their vaccines and have gone through the 14 days or 10 days or whatever it is, now it's okay, or they're reducing, like you said, dialing down the restrictions so that people who have had their vaccines can be maskless with other people who've had their vaccines as well. So I see a trend where things can be relaxed if people do get their vaccines and do, you know, what they should be doing. And if it starts to trend down, I think there'll be some more dialing down of the restrictions. Don't you think, Mark, as we finish?
Well, I think that there's a certain psychology and a certain strategy that has to be used to cope with where we are in the pandemic. I think it's understandable that that most people don't like to be told what to do. Most people don't like to be called out or bullied for not doing something, even if it's good for them. Like, don't eat, you know, I don't want to eat my vegetables. I don't want to take my vitamins. I want to continue smoking. I'm allowed to have 5 beers a day. There is that. And so to the extent that the people that are trying to get the population to come in line are doing it with a heavy hand, we all can understand why that's problematic. But that doesn't mean, again, that there shouldn't be an effort to, as you say, dial down, because there's still so much we don't know. We don't know how long this immunity lasts. We don't know the extent to which these vaccines are going to be able to tackle the mutations. There's so much that we have to learn. And part of that, again, is because we're still in the early phases. The vaccines that have been approved or been approved conditionally, emergency use authorization. But over time, as we learn more and more, certain things can be dialed down. But again, I think the last to go would be allowing people in close proximity and indoors to simply pull off the mask and go without it. Doesn't seem to make sense. It doesn't seem to be a great proportionality.
Well, I want to thank you for putting together this program on masking and vaccines. This is an excellent program. Thank you so much for doing this. And we look forward to seeing you again soon.
Thank you.